Hey everybody, welcome to the channel of Two Broke Doctors. This is Dr. Ria, and today we are going to talk about what will happen in All India Round 3. Is there will be a negative shift in All India Round 3? As we all know that All India Round 2 allotments are out and we saw a huge negative shift in All India Round 2 results. But is that going to happen in All India Round 3 also? What will happen? Will we get a positive shift? Will we get the negative shift? Will we get our desired college or not? That's all we are going to talk about today. We are going to discuss about the 7 subjects today, which we have seen major negative shifts in round 2. These subjects which we are going to talk about is radio, dermat, patho, psychiatry, pediatrics, general medicine, and emergency medicine. We are going to talk about these 7 subjects. For more subjects, we are going to make more videos, and please stay tuned for those videos. They are going to come out very soon. Um, all these videos will help you in making the decisions better, what college to choose, what state to choose, in which state there is more negative shift, in which state there is more positive shift. We are going to compare these two rounds, closing rank of round 2 in 2023 and 2024, because we have been told multiple times that in 2024 there is a huge negative shift in round 2, but in 2023 there was no such huge negative shift in round 2. So we are going to compare that how much negative shift has been there since the last year. So we'll talk about it. So let's start with this. So we'll start with the first state, that is going to be our Andhra Pradesh. Andhra Pradesh, if we talk about Andhra Pradesh, if we are talking about general category, in Andhra Pradesh, radiology has some kind of negative shift. Last year, the closing rank was 2005 in 2023, but this year closing rank for round 2 is 1805. Then coming to general medicine, there's a huge positive shift. Dermat has a positive shift. Pediatrics has a positive shift of almost 1000 rank. Psychiatry has a positive shift of almost 2000 rank. Pathology, almost similar, no change, no negative shift, no positive shift compared to last year. And emergency medicine has a little bit negative shift of 1000 rank. Coming to OBC category, OBC 2023 and 24, if we compare, radiology has a negative shift, general medicine positive, dermat almost positive, pediatrics positive, psychiatry positive, pathology negative shift, 3000 rank negative shift is there compared to the last year, emergency medicine positive shift. Very good. Coming to the SC category, we have positive shift in radiology, we have positive shift in general medicine, negative in dermat, pediatrics positive, psychiatry positive, patho almost negative. Coming to emergency medicine, seats are not available for SC category. Last year also and this year also. Coming to ST category, if we talk about radiology per se, there is a negative shift. General medicine almost good positive shift. Dermatology positive shift. Pediatrics positive shift, you can see. Psychiatry has a huge negative shift if we are talking about the ST category in the state of Andhra Pradesh. Pathology almost same. In emergency medicine, last year there was no seat, and this year 47,391 is basically the seat has gone for emergency medicine. Coming to EWS category, we have seen negative shift in radiology, general medicine positive, dermat positive, pediatrics almost similar. Coming to psychiatry, negative, pathology is positive, and emergency medicine this year there is no seat for emergency medicine for category EWS. So this is the state of Andhra Pradesh. If we see, there's almost huge shift in almost 5 subjects. If we are going to talk about general medicine, dermat, pediatrics, psychiatry, and radiology, in some categories there's little bit negative shift, but overall there's a positive shift when compared to the last year 2023 round 2. So Andhra Pradesh is a state where we can choose the branch, where we can choose to go basically, because it is seeing positive shift. So we are expecting that in round 3 there will be a huge positive shift in all these branches. Coming to the next is your Assam state of Assam, and here the shifts are like this accordingly. If we are going to talk about general category, radiology has a positive shift, dermat has a negative shift, almost 2000, almost 50% negative shift is there. General medicine is a little bit negative, pediatrics negative, psychiatry little bit negative, pathology little bit negative, and emergency medicine negative. So for general category, it is mostly the negative shift for all the subjects except for radiology. Coming to OBC, negative in radio, negative in dermat, positive in general medicine, a positive in pediatrics, positive almost equal in psychiatry, patho negative, and emergency medicine this year it has gone to 14,492 in OBC category. Coming to SC category, positive in radio, positive in dermat, negative in general medicine, pediatrics. This year there is no seat for SC category. Psychiatry, almost similar, and patho positive. Coming to ST category, radiology, there is good negative shift. Dermat, there are no seats this year. General medicine, negative. Pediatrics, this year 44,000 minus 77. Psychiatry, negative. And pathology, little bit negative. AWS, radiology, almost negative. Dermatology, negative. General medicine, positive. Pediatrics, this year 10,618. Psychiatry, little bit positive. Pathology, this year 55,674. So overall in the state of Assam, we can say for the category of SC and for the category of OBC, there could be a little bit positive shift. In general category, there could be a little bit of positive shift in the radiology branch, but we can't see much of the positive shift in the state of Assam. So choose wisely if you are choosing. We can't see much of the positive shift in round 3 too. Coming to the next state is Bihar. Bihar, if we talk about, there is a good positive shift in radiology coming in general category. Dermat, there is negative. General medicine, positive. Pediatrics, a little bit negative. Um, 1,000 rank negative. Psychiatry, positive. Patho, negative. Okay, so this, according to this, there is a good chances in radio and general medicine per se. OBC, if we talk about, there is a negative shift in radio, negative shift in basically patho, huge negative shift in patho. Almost rest, dermat, general medicine, pediatric psychiatry are almost similar. So huge negative shift for patho this time. Emergency medicine seats are not available in the state of Bihar. Coming to SC category, radio has a negative shift. Dermat seats are not available. General medicine has a negative shift. Pediatrics almost similar shift. Pathology, little bit downside. ST category, we talk about radiology, huge negative shift. Dermat, this year there is no seat. General medicine, if we talk about huge negative shift. Pediatrics, almost positive shift, huge positive shift. General psychiatry, if we talk about, there is no seat this year. Pathology, there is huge negative shift. Coming to EWS category, this year radiology no seats, dermat no seats, general medicine this year huge negative shift, pediatrics there is a huge positive shift present, psychiatry negative, almost, and pathology negative. So coming to the state of Bihar, if we talk about pathology, there is huge negative shift in the state of Bihar, but rest all other branches there is almost no positive or negative shift. So if you are considering the state of Bihar, there will be no much shift in round 3 too. You can check the round 3 closing rank of last year. There will be almost similar closing rank of this year round 3. Coming to the next state is state of Chandigarh. If we talk about the state of Chandigarh, radiology has almost negative shift in the general category. Dermat, there are no seats. General medicine, almost same. Pediatrics, negative. Psychiatry, negative. And patho, also negative. OBC, if we talk about negative in radio, dermat, no seats are there. General medicine, negative. Pediatrics, negative. Psychiatry, this year, no seats. And pathology, almost same or little bit positive shift. Coming to SC category, no seats in radio, dermat negative. General medicine, there is huge positive shift. As you can see, in 2023, there was the closing rank was 1786 and this year closing rank is 7290. Huge positive shift. Congratulations to SC category. Pediatrics, there is a huge positive shift. Psychiatry, negative shift. Pathology, no seats available this year. ST category, we talk about no seats available in radio, dermat. General medicine, negative. Pediatrics, last year there were no seats, so we can't compare. But this year the closing rank is 17,119 and psychiatry 55,099. Pathology, this year no seat. EWS category, little bit almost same in radiology, dermatology 2,264. General medicine, negative shift. Pediatrics, no seats available this year. So overall, when we talk about the state of Chandigarh, there is not much positive shift present here. Almost negative shifts in main core subjects like general medicine and radiology. Even in fact, dermatology only SC category seats have came. So there is a huge negative shift we are expecting in the state of Chandigarh in round 3 too. There is no much positive shift. So if you're choosing Chandigarh, if you want to go to Chandigarh and you're aiming Chandigarh in round 3, choose wisely and try to fill more other options. Coming to the next state is our Delhi. Delhi, if we talk about Delhi has a huge negative shift in general category in radio, general medicine, almost positive shift, pediatrics, negative shift, psychiatry, negative, patho, negative, good positive shift in dermat, basically. OBC, if we talk about negative in radio, negative in your patho. So patho has basically negative shift, but good positive in general medicine, good positive in pediatrics, almost similar in psychiatry, almost similar in dermatology. Coming to the SC category, radiology almost similar from last year, dermatology almost little bit negative shift, general medicine huge negative shift, SC category there is huge negative shift present, psychiatry almost huge negative shift, and pathology to huge negative shift. So for the ST category there is huge negative shift if we talk about Delhi per se. ST category positive shift in radiology, negative shift in dermatology, general medicine there is negative shift, pediatrics there is negative shift, psychiatry negative, and pathology also negative. EWS, if we talk about, there is positive shift in radiology per se. Dermatology this year no C. General medicine almost similar. Pediatrics negative. Your psychiatry is way more positive this year for EWS category. Coming to your pathology, pathology is almost similar. So when we talk about Delhi, Delhi again is the state where there is no much shift we have seen, and we have seen the shifting, it is mostly towards negative side if we compare the core subjects like radiology and general medicine. Very less categories has a little bit positive shift or almost no shift. So consider choosing Delhi wisely. Guys, if you are aiming for round 3, there might not be a major shift in the state of Delhi. Coming to the next state we have Gujarat. Gujarat, if we talk about the general category, there's a good shift in radiology, dermatology little bit negative, general medicine negative, pediatrics little bit negative, psychiatry almost similar, pathology almost similar, emergency medicine negative. So there is not very good positive shift in general category, but also not very negative shift in general category. They are almost similar to the last year. OBC, we talk about, there is a negative shift, good negative shift in radiology, dermatology positive, general medicine almost similar, pediatrics similar, psychiatry good positive shift this year, pathology negative shift. So as we have seen in all other 4 states which we have talked about, we have seen huge negative shift in pathology this year. In these 4 states, the huge negative shift in pathology was present, and in this particular state, Gujarat also is having huge negative shift in pathology if we compare different categories. See, if we are talking about general category, there is almost no shift. If we are talking about OBC, there is negative shift. The SC category has a positive shift here. ST again no shift, and EWS again not very much variation in pathology per se. If we talk about ST has a huge positive shift this year in Gujarat, in the state of Gujarat, in the branch radiology. Dermat didn't got any seats. General medicine, there is negative shift. Pediatrics, there is almost little bit negative shift. Psychiatry, okay, psychiatry is okay. 44, 542, almost positive shift. If we talk about pathology, not much of the variation. EWS category again negative shift in general medicine, pediatrics almost similar, psychiatry similar, and not much variation in pathology. Emergency medicine this year general category negative, OBC के लिए it is very positive, and EWS के लिए this year no seat. Coming to the next state, so overall Gujarat again is the state where there is no much variation present, almost equal to the 2023. So if you want to know where your rank holds, where will you get your college, just see the closing ranks of 2023 round 3. You will get a rough idea of where you are going to get the rank. There is not much huge negative shift this year, but not much huge positive shift. There is not much variation per se. Coming to the next state of Haryana. If we talk about Haryana, Haryana has a no shift in almost the mat. little bit negative shift in radio, good positive shift in general medicine, pediatrics positive shift, psychiatry positive shift, patho positive shift, very good, and emergency medicine also this year they got seat. So general category people, if you're choosing Haryana, if you're willing to choose Haryana, there is a good possibility that you might get a very good seat in Haryana in round 3. Coming to OBC, there is a negative shift in radio. Dermat, this year they didn't get any seat. General medicine positive, pediatrics positive, psychiatry little bit on the lesser side, little bit on the negative side. Pathology, not much variation, but little bit on the negative side. And emergency medicine, this year they didn't get any seat. SC category, if we talk about radiology, no seats. Dermat, no seat this year. General medicine, little bit positive. Pediatrics, there is a negative shift in SC category, so choose wisely according to that. Psychiatry, if we talk about, there is little bit of negative shift here present. So for psychiatry, also choose wisely. Pathology, if we talk about, there's a negative shift present here, and emergency medicine, there's a little bit positive shift. So SC category people, if you're going to choose the state of Haryana, choose wisely for pathology, psychiatry, pediatrics. And dermat and radio seats are not available. ST category radio seats are not available, derma seats are not available. This year general medicine has a negative shift. Pediatrics almost same. Last year there was no seat for pediatrics and psychiatry. This year there is no seat for pathology, emergency medicine. Coming to EWS good normal positive shift in radio, and rest no seats. Okay, so if you're talking about coming to the state of Haryana, for general category people, there might be a good positive shift in all the core subjects which we are talking about. So you can try choosing the state of Haryana in round 3. We are expecting a good positive shift in round 3 in the state of Haryana. Coming to the next state is Jharkhand. Jharkhand, if we talk about general category people, radiology has a huge negative shift. Dermat, there are no seats present. General medicine has a positive shift. Pediatrics, no not much variation, but on the positive side. Psychiatry, little bit on the negative side. Pathology on the negative side. Coming to OBC 2657, 1917, there's a huge negative shift. To Dermat, there is no seat. General medicine negative, pediatrics little bit on the positive side, psychiatry on the positive side, and pathology no variation. Coming to SC category, 9064 is the closing rank for this year for radiology, 10,354 dermatology. And coming to the general medicine, no much variation, but a little bit on the negative side. Pediatrics, huge positive variation. So if you're going to choose pediatrics, you can choose in the state of Jharkhand. You'll get the good positive variation. Coming to psychiatry is basically negative. Pathology, almost your positive here, so you can choose pathology also in this state for SC category. Coming to ST, if you talk about dermatology, radiology seats are not available. General medicine negative shift, pediatric seats not available. Psychiatry not much variation, 4000 variation. You can choose psychiatry, little bit positive edge pe hai. Pathology, if we talk about, pathology has a huge positive shift in the category of ST. Coming to EWS also has a pathology on the greater positive effect, like positive shift is there. If we talk about the psychiatry, positive shift is there. Rest seats are not available. Radiology also has a positive shift. So coming to the state of Jharkhand, if you are willing to participate in the state of Jharkhand counseling, like All India counseling, and you want to take Jharkhand as a state, you can opt for patho here has a good positive variation, good positive shift. You can opt for psychiatry also, good positive shift this year. Okay, coming to the next state is Karnataka. If we talk about radiology, negative shift in general category, dermat positive, general medicine almost similar, pediatrics positive, psychiatry negative this year, and patho negative this year. So if we talk about, there's a good variation in dermatology this year in the state, general category in the state of Karnataka. Coming to OBC has basically this year negative shift in radio, negative shift in dermat, almost similar shift in general medicine, though 1000 ranka variation is present. Pediatrics, good positive shift. Psychiatry, if we talk about, no variations. Pathology, little bit on the negative side. Coming to SC category, little bit on the negative side. Radiology, dermatology negative. General medicine, if we talk about, little bit on the positive side. Pediatrics, little huge positive shift is present. Psychiatry, last year there was no seat, so we can't compare much. and pathology there is negative shift. Coming to ST category, if we talk about ST category, there is a last year there was no seat for radiology, so we can't compare much. Coming to dermat, there's a little bit negative shift. Almost similar. General medicine, huge positive shift. So you can choose general medicine in the state of Karnataka if you belong to the ST category. We are expecting a huge positive shift in round 3 too. Coming to pediatrics, positive shift to present, huge positive shift present. Psychiatry, no seat available last year, and almost similar pathology. EWS, if we talk about similar dermatology, general medicine a little bit on the higher side, positive shift. Pediatrics, same. Psychiatry, little bit on the negative side. Psychiatry for EWS category in the state of Karnataka is on the lower edge, is on the negative side. So please choose wisely, guys. Pathology is also on the negative side. So coming to the state of Karnataka, overall there is a good positive shift in general medicine, as we can see in each and every category. Good positive shift in pediatrics almost. So you can choose the main these core subjects in general medicine, pediatrics in the state of Karnataka. In round 3, there is a good possibility that you will get a good seat in Karnataka for these two particular subjects. Pathology, still negative shift in in the state of Karnataka. Coming to the next state is Kerala. Kerala, if we talk about, there's a negative shift in radiology, dermatology negative, general medicine almost similar, pediatrics similar, psychiatry little bit on the positive side, pathology negative, and emergency medicine negative. For general category people, all core subjects these are negative. Although psychiatry is on little bit positive side. Coming to OBC, radio negative, dermat negative, general medicine positive side, almost 1000 rank of variation is present in OBC. So you can choose general medicine OBC category in the state of Kerala. Coming to pediatrics, huge positive variation. I think it's not 4856, guys, it is 4856. So good positive variation present. Coming to our psychiatry, less positive variation, coming more on the negative side. Pathology, no, not much variation present. For the category of OBC, coming to SC category, if we talk about, there is a huge good positive variation in radiology. Dermatology, there is a negative shift. To general medicine, there is good positive variation, good positive shift. To pediatrics, good positive shift. To psychiatry, good, and pathology also good. So for this category of ST, there is a good positive shift present in the state of Kerala. You can choose Kerala for the category of ST if you want to take any one of these subjects. ST, if we talk about, not much radiology on the negative side, dermatology on the negative side, general medicine on the positive side, pediatrics on the positive side, psychiatry, this last year there was no seat, we can't compare much. Pathology, there is no seat last year, we can't compare much. Coming to radiology, positive shift in EWS category, general medicine positive, pediatrics little bit negative side, psychiatry 27513, last year there was no seat, and pathology almost similar. So for the state of Kerala, general medicine, pediatrics both have positive shift on almost all categories. You can choose to come here. ST category people have much more SC category people have much more advantage over other category people in the state of Kerala. Coming to the Madhya Pradesh, the central heart of our India. So coming to here, general category, radiology, again negative shift is there, huge negative shift is there, dermat negative, general medicine almost similar, pediatrics similar almost, though 800 rank of variation is present, we'll say it is on the negative side. Psychiatry on the negative side, again patho huge negative variation. Choose wisely, guys. The only thing, general medicine has not much variation. You can choose that, and you can choose accordingly round 3 में what do you want to have in Madhya Pradesh, but not much variation, mostly on the negative side Madhya Pradesh. Coming to OBC category, negative in radio, little bit positive on dermat, general medicine little bit positive side, but normal. Pediatrics little bit on the negative side, but same, not much variation. Psychiatry not much variation, little bit on the negative side. Pathology negative side, and emergency medicine is positive side. Coming to SC category, radio positive, dermat no seats available, general medicine little bit on the negative side, pediatrics positive, psychiatry negative, and patho again negative. Coming to ST category, this is basically radio negative, dermat no seats available, general medicine if we talk about negative, pediatrics positive shift present, psychiatry this year no seat available, and patho negative. Coming to EWS category, radio negative, Dermat, not much variation. General medicine, not much variation. Pediatrics, not much variation. Psychiatry, little bit on the negative side. Patho, little bit on the positive side. So overall state of Madhya Pradesh, not much variations are present, little bit on the negative side we can say. So choose wisely accordingly. Choose the state of Madhya Pradesh if you are willing to go to the round 3 in the state of Madhya Pradesh. If you want the branch in the Madhya Pradesh, please choose wisely. Check your rank again and open your option. Open more options for you. Coming to this next state of Maharashtra, if we talk about uh, general category, radio negative shift is there. Dermat almost similar. General medicine same shift is there. No negative, no positive. Pediatrics not much negative. Psychiatry huge negative shift is there. Pathology negative shift is there. Emergency medicine negative shift is there a little bit. We'll talk about OBC, negative shift in radio, negative shift in dermat, positive shift in general medicine, positive shift in pedia, negative shift in psychiatry, negative shift in patho, and positive shift in emergency medicine. SC category, we talk about positive in radio, dermat, there is negative shift in dermat, general medicine negative, pediatrics huge positive, psychiatry huge positive in the category of SC, pathology almost similar, no variation, emergency medicine this year 3254 is the closing rank. Coming to ST category, huge positive variation in the radiology, dermatology not much variation, negative shift. General medicine not much variation but on the positive side. Pediatrics positive side. Psychiatry this year 62992 is the closing rank. Pathology huge positive shift present in the category ST in the state of Maharashtra. So for category ST, this is the golden state, you can say. Huge positive shift in radio, dermat, general medicine, pediatrics, and your pathology. This year, emergency medicine and psychiatry seats are also available for the category ST. Coming to EWS, EW has good positive variation, radio, dermat negative, general medicine positive, pediatrics positive, psychiatry a little bit negative, pathology almost similar, and emergency medicine almost similar. So overall, state of Maharashtra can be seen as a positive shift in round 3 because there is not much negative room in the state of Maharashtra. So we can choose Maharashtra. You can fill up the options of Maharashtra. Check the closing rank of round 3 in 2023. You will get almost an idea. Till this state, we all know that we have been saying, or we have been seeing people saying that in general medicine and pediatrics there is huge negative shift this year, but we have almost completed around 10 to 11 states and we have not seen much negative shift in general medicine and pediatrics when compared to last year. You guys can always go back and take screenshots of all these slides per se and check yourselves that there is not much negative shift if we talk about for every category available there. So there might not be a negative shift, but just that there is too much blocking present right now. That's why it is looking like a negative shift. Also, there are many states this year who has not even completed round 1 when all India has completed round 2. So there's a good possibility that round 3 will have a huge positive impact, huge positive shift. Coming to the next state, not wasting much of our time, Odisha. Odisha, if we talk about radio negative, dermat negative, general medicine, little bit positive, pediatrics, okay, not much variation, psychiatry, not much variation, patho, little bit on the negative side. OBC, if we talk about radio, huge positive, dermat negative, general medicine little bit positive, pediatrics positive, psychiatry negative, and patho again negative. SC category, there are no seats for radio and dermat. If we talk about general medicine, good positive shift present, pediatrics good positive shift present, psychiatry no seats available, pathology huge negative shift. Coming to ST category, no seats for radio this year. Dermat seats closing rank is 13,029, general medicine 19,856, pediatrics 42,357, 60,136 for psychiatry, and pathology 52,609. Coming to EWS category, radiology fresh seat 1613, no seats last year. Dermatology this year no seat. General medicine huge negative shift is present this year in EWS category. Pediatrics not much variation, psychiatry not much variation, No seat this year, pathology, little bit on the positive side. So if we talk about Odisha, not much positive things we have seen. Almost similar to the last year. Huge negative shift for patho per se, negative shift for psychiatry. We have seen more negative shift in patho and psychiatry this year as compared to other subjects, other main core subjects. So don't worry, guys, if your goal is to have the main core subject like general medicine, pediatrics, not much of the variation is present, honestly. But this year patho has changed the game. Patho and psychiatry, I think, has changed the game. Huge negative shift. More people are opting for patho this year, psychiatry this year, and we have seen up till huge negative shift in all the states. Coming to the next state is Punjab. If we talk about Punjab, then Punjab almost radio negative, dermat negative, general medicine negative, pediatrics negative, psychiatry negative, and patho again negative. Coming to OBC, negative, dermat 4823, general medicine, little bit on the positive side, pediatrics negative, psychiatry negative, patho negative. SC category same negative, dermat little bit on the positive side, general medicine negative, pediatrics no seats, psychiatry no seats, and pathology negative. ST category we talk about radio negative, dermat 19,387 is the closing rank, general medicine negative, pediatrics and psychiatry closing ranks are these, pathology negative. EWS, if we talk about negative, a little bit on the positive side in for general medicine, pediatrics, little bit positive side, psychiatry, huge positive shift for EWS category in the state of Punjab. So you can choose that. Choose to look for round 3 in this particular state for EWS category. Pathology, huge negative shift. So as we can say, there is a negative shift in the state of Punjab. North Indian states are usually having the negative shift, as we have seen up till. We have seen Gujarat, we have seen Madhya Pradesh, we have seen Punjab, we have seen Delhi, Chandigarh. All these states are usually having the negative shift in almost all the branches. So guys, choose wisely. If you really want a branch per se, take the branch. Don't hesitate to go to South India or something like that, because this year South India has good positive shift present. So don't hesitate, take it. If you're feeling like, I have to take it in North India, and if you're willing to drop per se, then you can take drop also. But I would say that if you're getting a branch in South India and there's a good shift there, you should take that. Coming to the state of Rajasthan, if we talk about radiology negative, dermat negative, general medicine, little bit on the positive side, pediatrics negative, psychiatry negative, patho negative, emergency medicine 8457 closing rank this year. OBC, if we talk about radio negative, dermat negative, general medicine, little bit on the positive side, pediatrics, little bit on the positive side, psychiatry negative, patho negative, and emergency medicine, huge positive shift is there. SC category, we talk about negative radio, negative dermat, a little bit positive in the general medicine, pediatrics negative, psychiatry negative, patho negative, emergency medicine negative. Coming to the ST category, radio little bit positive side, dermat negative, general medicine negative, pediatrics negative, psychiatry negative, patho almost same side we can say, emergency medicine little bit positive. AWS, if we talk about negative in radio, dermat 2223, general medicine negative, pediatrics negative, psychiatry almost negative, negative, patho also little bit positive side. But if we see general medicine, almost not much variation is present if we see in all these ranks, like in all these categories. So you can choose Rajasthan, not much of the changes will be seen in round 3 compared to the last year. Choose wisely, choose accordingly. Okay, coming to the next state. Next state is Tamil Nadu, the core South Indian state. We'll talk about it. If we see radio positive, dermat positive, general medicine positive, pediatrics positive, psychiatry positive, patho positive, emergency medicine positive. Good state in general category, all these are positive. You can choose Tamil Nadu as your upcoming state for NEET PG for post graduation basically. Good positive shift present. OBC also positive, general medicine positive, pediatrics positive, psychiatry positive, patho positive, and even emergency medicine positive. SC category positive, huge positive shift present, radiology, dermatology positive, general medicine positive, shift pediatrics plus positive shift, psychiatry positive, pathology positive, emergency medicine positive. Very good. All these categories have positive shift present. If we talk about ST person, there's a little bit of negative shift, but not much of the variation present. In EWS category also not much of the variation present. Positive, mostly on the positive side. So guys, if you're willing to join in any of these branches and if you're not getting seat in North India because of the negative shift, South India can be your forte, can be your place, because we have all seen that Tamil Nadu has a positive shift. So we can expect good results in round 3. Coming to the next state of Telangana, we talk about a little bit negative, almost same in radio, general category, dermat positive, general medicine positive, pedia positive, psychiatry same, patho negative side, and emergency medicine positive. Okay, OBC we talk about radio positive, dermat positive, general medicine positive, pediatrics good positive, youth positive, psychiatry we talk about a little bit negative side, pathology positive shift, emergency medicine negative shift. Okay, coming to the SC category, now if we talk about radiology per se, good positive shift is there. Dermatology, there's not much variation. General medicine, if we talk about, not much variation. Pediatrics, not much positive, but on the positive side. Psychiatry, we talk about negative, patho positive. Okay, coming to ST category, negative in radio, almost same in dermat, negative in general medicine, pediatrics, good positive shift is there, psychiatry, good negative shift is there, pathology, positive shift is there, huge positive shift is there, dermat 57,380, emergency medicine 57,380 is the closing rank. Coming to EWS category, radio negative shift, dermat negative shift, general medicine positive, pediatrics almost similar, psychiatry we talk about there is a negative shift, pathology positive shift, emergency medicine, pathology. So for the state of Telangana, if we say there's a good positive shift in general medicine, pediatrics, psychiatry has a negative shift in the state of Telangana for all the categories, but core subjects like general medicine, pediatrics, dermat almost has a positive shift. Even emergency medicine has a positive shift. Dermat also in this state, pathology also in this state also has a little bit positive shift. So you can choose wisely. Coming to the state of Uttar Pradesh, if we talk about, there's a negative shift in general category in radio, almost similar in dermatology, good positive shift in general medicine, pediatrics, no, almost same, psychiatry, same, patho, negative, emergency medicine, positive. Coming to OBC category, radio, positive, dermat, positive, general medicine, same, pediatrics, same, psychiatry, negative shift, pathology, negative, and emergency medicine, positive. Coming to SC category, positive shift in radio, dermat, negative, general medicine, negative you can say, pediatrics you can say positive, psychiatry negative, patho okay positive, good positive shift is there, emergency medicine. This year SC category 30,396 is the closing rank. Coming to ST category, we talk about radiology, good positive shift, dermatology we talk about, negative shift is there, general medicine negative shift is there, good pediatric shift, positive shifting is there in the ST category in the state of Uttar Pradesh. Psychiatry negative shift, pathology almost similar. EWS good positive in radiology, no dermat seats this year, no shift in general medicine, and almost no shift in pediatrics if we talk about, but on a positive side psychiatry, pathology positive side. So overall Uttar Pradesh is basically not much variation, but on a positive side it is present. You can check around 2023 closing ranks and you can choose accordingly. Mostly it is a positive for general medicine and pediatrics and somewhat radiology too. Psychiatry is a little bit negative, pathology is a little bit negative. Okay, coming to the last state is West Bengal. West Bengal, if we talk about, almost same in radio, general category same radio, same dermat almost, general medicine also almost same, pediatrics little bit on the negative side, psychiatry negative side, and pathology to negative side. Coming to OBC category, positive in radiology, dermatology positive, general medicine almost similar, pediatrics good on the positive side, psychiatry negative side, and again pathology not much variation. Coming to SC category, not much variation, radio, dermat seats are not available, general medicine good positive change, good positive shift, pediatrics good positive shift, psychiatry very good positive move in ST category, pathology if we talk about, negative shift is there. ST category if we talk about, radio negative, dermat negative, general medicine negative, pediatrics positive, psychiatry negative, and pathology no seat available. EWS category we talk about good in radiology, good in general medicine, pediatrics huge positive, psychiatry huge positive, and pathology again negative. So overall, Uttar Pradesh also West Bengal also has a little bit negative edge on pathology, but good positive edge on general medicine, pediatrics, negative edge on psychiatry, good positive edge on radiology. Guys, all these branches, all these categories in all these states we have talked about. Basically, all these shifts depend on the amount of seats available for every category and amount of seats given